Just a day after Philonis Floyd buried his older brother George Floyd, he went before Congress, pleading with lawmakers and the rest of the nation to remember his brother and to do something about his death.
He was mild-mannered. He didn't fight back. He listened to all the officers. The man who took his life, who suffocated him for 8 minutes and 46 seconds, he still called them sir as he begged for his life. I can't tell you the kind of pain you feel when you watch something like that. When you watch your big brother, who you looked up to your whole entire life, die begging for his mom, I'm here to ask you to make it stop. George called for help and he was ignored. Please listen to the call I'm making to you now, to the calls of our family and the calls ringing out the streets across the world. People of all backgrounds, genders, and races have come together to demand change.
Since George Floyd's killing, several cities and states have moved to ban chokeholds, and the Democratic proposal in Congress would do that and more. But many argue that's not nearly enough. Today in Minneapolis, where Floyd was killed, Police Chief Medaria Arradondo acknowledged the systemic racism that led to his death, and that unions often make it difficult to get rid of problem officers, something he said needs to change with a complete restructuring of union contracts.
I am immediately withdrawing from the contract negotiations with the Minneapolis Police Federation. I plan to bring in subject matter experience and advisors to conduct a thorough review of how the contract can be restructured to provide greater community transparency and more flexibility for true reform. Race is inextricably a part of the American policing system. We will never evolve in this profession if we do not address it head on.
He also said that being a rookie cop was no excuse for those who looked on and did nothing as George Floyd was murdered. As for calls to defund police, Chief Arradondo said his top concern is public safety of all the city's residents, which he will not abandon. It's an issue Boston Mayor Marty Walsh addressed today as well, which we'll get into in a few minutes. But first to the growing concerns about coronavirus spreading across the country, officially topping 2 million in all today, and at least 21 states are tracking rising numbers of cases. That's according to a New York Times tally, in part likely due to increased testing, but also because of increased movement as the nation has been reopening. And at least a dozen states are reporting a rise in hospitalizations since Memorial Day, with some near capacity in their ICUs. It's a scenario Dr. Anthony Fauci, remember him, yesterday said has turned out to be his worst nightmare, saying, quote, in a period of 4 months, it has devastated the world, and it isn't over yet. Fauci also addressed this week's confusion over a WHO doctor's statement that asymptomatic transmission was, quote, very rare, and on that point, he was clear.
The evidence that we have, given the percentage of people, which is about 45% of the totality of infected people, likely are without symptoms. And we know from epidemiological studies that they can transmit to someone who is uninfected, even when they're without symptoms. So to make a statement to say that's a rare event was not correct.
I'm joined now by Dr. Vanessa Kerry, Director of the Program in Global Public Policy and Social Change at Harvard Medical School, and the CEO of the nonprofit Seed Global Health. Doctor, it's good to see you again. Thanks for coming back.
Thank you for having me.
Those numbers I read a minute ago, to me, are stunning. 21 states, almost half the states, have increased numbers. A dozen states increased hospitalizations. Did America, or at least much of America, open too soon?
But I think it's worth noting that a dozen states actually have the highest numbers of cases being reported since the pandemic began. So we are actually really looking at what is a new and unbelievable wave of COVID in this country. The question of whether we reopen too soon, it's more a question for me of did we reopen with the right precautions and with the right ability to actually combat COVID in a way that is necessary. And so if you look at Massachusetts, we've been very thoughtful about the time span between which we will open a new phase. I think our metrics have been going down. I think it's reasonable for us to think about what reopening looks like. But reopening needs to be done responsibly. Everybody needs to be wearing masks. You need to be able to socially distance. And I think that a number of states did, in fact, open too soon because they reopened, like Georgia, when they weren't seeing a decline in cases over a sustained period of time. The truth is, COVID is here. We have to address it. And our economic security, the reason we've been reopening, is only going to be secure if we address COVID and have our health security in place.
You know, the thing that I don't quite understand, though, we seem to approach this, as a layperson, I'm saying this, as if there is a wall between states which ensures that while Arizona's public health chief today said, we're in big trouble, we may run out of hospital beds, that's walled off from Massachusetts or Missouri. There are no walls. So when 21 states see numbers going up, and as you said, highest numbers in some states, what does that mean for all the rest of us who are lucky enough not to live in Arizona or Texas or Florida, where they did disregard the rules of the road?
No, the reality is we as a country are going to be needing to buckle down for a new wave of this pandemic. We are already over basically 2 million cases out of the total close to 7 million happening around the world. And so we have already got by far the worst pandemic, and it is only about to get worse because we've not seen the kind of policies, leadership, and willingness to really shut down what's happening through contact trace, through testing, case identification and contact tracing, and then supportive quarantine. That's how countries have been effective at shutting down their pandemics. Countries like Vietnam, which has 98 million people, a health system that is not nearly as resourced as ours, and they've had 0 deaths. We, on the other hand, have had a huge number of deaths, the highest in the world. And so we have to recognize that people are going to start moving around this summer too. We live in Massachusetts. Cape Cod is going to be a hotbed for tourists, and we should expect and anticipate an influx of infections with that movement of people.
So you complimented the direction that Governor Baker has taken the state. What would you recommend he do about Cape Cod, where there is going to, I mean, already, starting with Memorial Day, the numbers increased dramatically. What should he be doing that he is not doing? Is there anything?
Well, I think that we as a state, I think, have done a tremendous job at trying to be as responsive as possible to what's happening in this pandemic. And it's part of the reason we have seen sustained cases drop, sustained drop in hospitalizations, and we've been in a better position. The key is going to be testing, accurate tests, rapid tests to let us know who's infected when. We need to have accurate and a robust contact tracing system so that when we identify a positive case, we know who's going to be getting sick. And some of the work that we're doing at Harvard Medical School is helping to support some of the policies behind that and support Partners in Health in their endeavors to support the state in contact tracing. But we also have to think about what supported quarantine means. And what that means is if you look at a community like Chelsea, which is north of Boston, and has had one of the highest case incidences in the world, one of the ways that we have to help dismantle the chains of transmission are by supporting communities that don't have the ability to socially distance, are essential workers, don't necessarily have access to information because of cultural language barriers. Support them to be able to quarantine safely without worrying about their jobs, their family, their safety, and their well-being. And we have to be willing to make those investments, or we're going to be suffering from COVID for a lot longer.
Should we not worry, though, about testing rates going down to some of the lowest levels we've had in quite a while in Massachusetts? Baker has talked a lot about dramatically increasing testing capacity, but the reality, he says it's a demand issue. The numbers are going down. Is that not cause for concern?
I think that we want to be vigilant. I think that the numbers going down probably reflect, we've been testing people who are symptomatic, people who think they've been exposed. I think because we were very effective in lockdown, people really hunkered down, that probably is reflected in some of the decrease in testing. I think the ability and the capability of having increased testing and people being responsible to get tested when they think they've been exposed. And frankly, if we could get a policy of almost testing everybody, that would be in an ideal situation so that we can identify those asymptomatic people that are responsible for transmission. So we want to be thinking about having the capacity is critically important. But I think it's going to be a time where we're going to start to see increased testing again.
One of the things I think about a lot is not giving arguments to people who are on the wrong side of the public health issues. I think the epidemiologist from the WHO, I'm sure was with good intentions the other day, was disastrous, even though they tried to walk it back when she talked about asymptomatic people very rarely transmitting the disease. You know what also concerns me is the vast majority of people who do what you do have decided that I agree with you, by the way, that social justice takes precedence over social distancing when it comes to demonstrations around the murder of George Floyd and systemic racism in this country. But most of the very same public health people were castigating demonstrators when they were approaching state houses. And I'm not talking about with guns, but approaching state houses against the lockdowns. Aren't we hypocrites for condemning one set of people exercising their First Amendment rights for a cause they believe in and another set of people who are just doing it for another cause that we consider to be more holy?
I think you're waiting, and I sort of blew a long sigh out because this is an incredibly difficult subject. I think that where I felt very frustrated by the previous demonstrations of people who were demonstrating not wearing a mask or other things like that is that they were demonstrating, for me, against what we know to be critical public health protections that actually protect human life and protect the ability for people who are vulnerable to live and to thrive, and that they were doing it in a way that was not necessarily safe. They were showing up without masks. The risk was very different when you are screaming and yelling and propelling droplets. I think that if people are racism in this country, though, what is driving the protests that are happening today is racism, which has been something that has been killing African Americans and others and many minorities, people of color in this country for years. And we have had millions more die from racism than we have had die, in the current COVID pandemic. And don't get me wrong, we are at a real, collision of two pandemics that are happening in this country right now, coupled also with, someone recently pointed out to me, an economic pandemic and they're all related. African Americans actually had the lowest unemployment rates since 1972 in February of this year. They now have one of the highest again in the setting of COVID. And so what we're looking at are people who are trying to protest, but most people have been protesting peacefully, trying to maintain social distancing, have been wearing masks, at least the images that I have seen in the protests that I've been able to witness. And so I think that what we have to realize is that there is a crisis that we also have to address in this moment, which is racism. And we have an opportunity to look at what is a public health crisis in this country of years. We have an opportunity to try to dismantle that too. And I think it's very conflicting for a lot of people, but the key is to stay safe as you do it.
I'm glad that you sighed, and I like your answer. Dr. Vanessa Kerry, thank you so much for your time as always.
Thank you so much for having me on and for tackling some of this. It's critical right now.
Thanks.